Medical thoracoscopy, otherwise known as pleuroscopy, which is used to diagnose the cause of a patient's pleural effusion. In this, a scope is passed into the thoracic cavity, and we can see here a pleural effusion, which is dependent. The chest wall is off to the top and right screen, and in the chest wall we'll see the various parts of the anatomy, including the rib, the intercostal space, and the area where the intercostal neurovascular bundle runs. I'm moving this scope in a counterclockwise fashion, and the lung comes into display at the bottom left of your screen. Around the lung is the visceral pleura. At the chest wall is the parietal pleura. And again, we see areas where the patient's ribs are in view. Those yellow areas are small areas of fat along the chest wall. At the bottom left of your screen is a mass, which is in the pleura, and is the likely cause of this patient's pleural effusion. Again, seen is some pleural fluid in the dependent fashion, and the pleural mass again comes into view. I'll continue in the counterclockwise fashion, and the bottom part of the lung, or the base of the lung, is again seen through the pleuroscope. You'll notice that the lung does not inflate, and that's because the visceral lining is thickened and does not allow the lung to do so. Just seen was the apex of the lung off in the distance, so we've approached the thoracic cavity from the bottom, and we look more towards the top. Again, you'll see the rest of the lung deflated during this procedure. I've passed biopsy forceps through the pleuroscope, and I grab pieces of the parietal pleura to strip away from the chest wall. This specimen is sent to pathology to review for the final diagnosis.